Coming up, we'll be on location at Grande Dental Care in Herndon, Virginia, discussing advances in sleep apnea treatment and how they can help eliminate the associated risks and help you breathe and sleep easier with one of this region's top dentists, Dr. Marcos Grande. Dr. Grande completed his residency at the Division of Maxillofacial Surgery Department at Jackson Memorial Hospital in Miami, Florida. He is a member of the American Academy of General Dentistry and the American Academy of Dental Sleep Medicine, among other organizations, and Dr. Grande is widely recognized as one of this area's leading dentists. Welcome, Dr. Grande. It's a pleasure having you on our program.
Thank you. I'm glad to be here with you, sharing this information with all of you.
Well, it's your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about. We have some patients that are going to be joining us a bit later. But I wanted to begin, if I may, Doctor, by asking you if you can please tell us what sleep apnea is, because we all know it's a very prevalent problem affecting many, many folks.
I got into the sleep apnea field because I realized that it's affecting more than 30 million Americans. It's an obstruction, a mechanical obstruction of the airway that happens during sleep in a specific stage of sleep, which is REM, rapid eye movement. Sleep itself is when we recover. We spend a third of our life sleeping, and that has a reason why. There's a specific time of sleep, which is REM, where all our muscles get paralyzed, and all the growth hormones and cell repairing enzymes are released in a pulsatile form, okay, and there's when we recover. What happened with the obstruction is that, every time we get the obstruction, we cannot breathe. The brain sends signals just to give you a micro arousal, and just you wake up, you stay away from REM, so you're not recovering. You take a rescue breath, and then you fall back to sleep, and that cycle repeats over and over and over again. There are different stages or different severities that go from mild to severe. And for the many years before, the only option for patients who used to be a CPAP machine, which is still the gold standard for sleep apnea, mostly for severes nowadays. And but now, based on the American Academy of Sleep Medicine, they have recognized intraoral appliances as a first line of treatment for mild to moderate cases. Of course, you need to have enough training and equipment to diagnose, not diagnose because we cannot diagnose sleep apnea, but we can pretty much screen very well whether or not the patient is at risk of having mild, moderate, or severe sleep apnea.
And a number of people each year we hear tragically passing away even from a sleep apnea condition. How do you determine, doctor, if a person is suffering from sleep apnea? What do they have to go through for you to determine that?
All right, so there are many things that you can tell by symptoms and signs. Usually the first thing I ask the patient, it's if they snore. And nowadays, probably 50% of adults over 40 years old snore. Snoring, it doesn't become a problem for health. It's not a health issue, but you need to be taken into consideration because everybody who has sleep apnea, they all snore. The first concern or the first thing they tell us is that they experience morning headaches on a daily basis. They spend the day pretty tired. They fall asleep in front of the computer. They have issues trying to concentrate. They fall asleep having a conversation or watching TV. And the risk of that, of course, is some people that have, gotten asleep, while driving back home, and that's a pretty serious condition. Actually, there's a report that says that most of the car accidents that have been related to people falling asleep are related to 50% of those cases are cases related to obstructive sleep apnea cases. 80 to 90% of people who suffer from sleep apnea don't even know that they have it, or they haven't been diagnosed or treated at all. And the other thing is that patients who wear the CPAP, who were diagnosed and are wearing the CPAP, which again, I have to stress this out for severe cases, is the gold standard to treat severe sleep apnea cases. Most of those patients, 60 to 70%, they're not compliant. They don't use it. And you know what? The CPAP industry in the United States, is costing a fortune to the healthcare system. It's called $5 billion a year.
My goodness.
All right. So if you have 6 or 7 out of 10 that get the CPAP, that the healthcare system is paying for that, but they're not using it, their problem persists. And then that's going to degenerate in several other problems like high blood pressure, diabetes type 2, strokes, heart attacks, not to mention car accidents.
Those are problems that can result from having this sleep apnea condition basically going undetected.
Well, actually, the first thing to understand the problem is recognizing the symptoms.
Yes.
That's very important for somebody and that's what I would like to, spread the word out. It's just you need to understand what are the symptoms in order to recognize if you have, that condition, whether you have the condition or not. So if you find yourself tired during the day, if you experience, morning headaches, you fall asleep, when at work or in front of the computer, you need to get tested. And that's something that I have also a dedicated site, which is called Grande Dental Sleep Solution, where you can get a lot of information. And I offer a free online test with a medical questionnaire you can fill up, and that goes directly into my medical portal. And I can look at those results, and I can determine whether the patient has mild to moderate risk of having sleep apnea. Once we figure that out, we always contact that patient, and we bring them in for an advanced sleep consultation. We consist in measuring the airways in the nose and the throat. Is called pharyngometry and rhinometry, but I'll go more in detail of that. And after that, if we still see that the patient is still at risk, and we can see clearly that the patient may have sleep apnea, then we recommend to get a polysomnography, which is a sleep study, on a hospital-based sleep lab with a sleep physician. And the reason being is because medical insurance, in order to cover partially the treatment plan or the appliance, they request the test or the sleep test to be done in a hospital-based sleep study lab and signed by a physician, because they are the only ones who can come up with a diagnosis of sleep apnea. We can screen and we can kind of tell if the patient has it or not, but we're not, as dentists, legally allowed to come up with a diagnosis, tell if you have sleep apnea.
So they go through the sleep study through a physician, whether it's a hospital or lab. Then once they get the written confirmation that they do suffer from a sleep apnea related condition.
That's correct.
Then they would come to someone like yourself, who obviously is a dental expert with a big specialization in sleep apnea, among other treatments that you offer here at your practice, to have the insurance covered for them.
Absolutely, absolutely. And so for the patients and the public out there to know, so I also offer a home sleep study device where I can get basically the same information, but since it's given by a dentist, we don't use it as an initial diagnostic tool. Okay. All right. However, once I deliver the appliance to my patients, I retest, the appliance to make sure that the airway is open, the patients are breathing well, and I send the patient home to get this sleep test in the comfort at home. So they bring it back, I plug it into my computer, that goes to a network of board certified sleep physicians, and they report me back in 24 hours to see what's the efficacy of the appliance. So I know if I need to titrate, the appliance or move the appliance a little bit in a horizontal fashion, I can do that until I get the patient to the ideal point where the patient is getting the maximal medical benefit.
So that's the technology that you utilize, or the process, I should say, as well, that allows you to determine the level of treatment that each patient is going to need to correct their sleep apnea problem.
That's absolutely correct, Rocco. Yeah.
What type of results can we expect from these treatments, doctor?
We measure success or improvement based on indexes. There are some indexes called the AHI, with AHI, which means it's the number of hypopneas and apnea episodes over 10 seconds that you have during the hour, in each hour. So that's a percentage. So if it's, for example, the mild, the number usually it goes from 1 to 15. For moderate, go 15%. So from the moderate goes from 16 to 30. And severe cases go 30 and above. All right. So with the appliances, what we're looking for is just for the mild and moderate cases, just to keep it below 10%. All right. And for severe is to keep it half, 50% of improvement. That's what an intraoral appliance can do for severe, and that's what an intraoral appliance can do for mild to moderate. So it can be improved big time.
Yes, and we're literally out of time, Dr. Grande. I just wanted to ask you before I let you go, you and your practice, Grande Dental Care here in Herndon, Virginia, has established a reputation for excellence in not only dentistry and sleep apnea related conditions and helping so many folks, but also in patient care. And I just wanted to ask you what you feel helps separate you all apart from the others.
Oh, absolutely. That's a great question. Ever since I became a dentist, I have the idea in my head that a general dentist should be well versed in all areas of dentistry, and you should do it to a specialty level. So I just started to branch out from the drill and fill, and that's why I got into dental implants and sleep apnea, among other cosmetic procedures. Those are my cases too. So, and not only just getting into different branches, but being or having the best technology available on each department. So basically what really sets me apart is that my patients, when they come here, they find that I can get all the dental needs in one office with the same doctor. So it's they say it's pretty convenient because they don't have to be, driving around town, just finding another, specialist, one for endodontics or root canal, another one to place the implant, then come back here. So they can get everything they need done, in one office in a few appointments.
Yes, indeed. And on that note, I'd like to thank you, Dr. Grande, for joining us again, being a guest on our program.